Okay, and I think we'll just finish with running and how you incorporate running into their program when you decide that that's okay, and how you sort of start that off and progress it.
Certainly running is it's a major milestone mentally for every athlete. When can I get back running? And I think the key point for what I try to do is I try and kill that conversation as quickly as possible by incorporating running as quickly as possible. So almost from week 3, week 4, we'll be incorporating running drills, which is different than increasing your running volume, but it immediately gets the athlete thinking, well, I'm already several steps along the line here. This is very, very positive. So whether it's posture drills or marching drills or wall drills, trying to incorporate those early patterns of good pelvic control, good swing leg recovery, and good triple extension is very, very important. And we can incorporate those drills very early on. I think when it comes to incorporating running, people often go back running just for the sake of going back running without any necessarily particular purpose or any sort of technical challenge on how you're going to, if we're saying that ACL injury is an opportunity and we're looking to leave them better than we found them, trying to look at their patterns of running and how we can improve their running efficiency over time, especially when they're not complicated by having to play a match and have high training loads in on top of it. Incorporating those drills as early as possible are going to mean that when you can move on to your running drills, they already have a very good understanding of what the fundamentals of good running mechanics are and a good proprioceptive or body awareness of the patterns of movement you're going to ask them to carry into the running streams.
So you get them doing short little running drills, so it might be up and down, short little bits early on, practicing their movement patterns, is that right?
Yeah, absolutely. So I think in terms of going into jogging patterns, etc., I certainly would want to be on to in terms of landing competency, I would want to be on to single leg landing drills or on the spot gentle hopping before I incorporate any sort of running volume into what I'm doing. But certainly in terms of leg change drills, posture holds, wall drills, etc., they can be incorporated very early on. I think that as opposed to going out for time and again, you'll see athletes who are going back running after ACL just doing laps of the field and laps of the field, and A, they're not necessarily getting any particular technical benefit from it, B, they're probably very sloppy with it and wondering why their knee is swollen afterwards, and C, in terms of improving their sporting performance, is that necessarily the method of running that you want them doing? So I try and incorporate their running program, and that running is like any other skill, that they're practicing their running rather than necessarily going out running for the sake of running. The earlier we can incorporate those drills and motor patterns into the running, when we go to increase the intensity, speed and duration of the runs, the better foundation that they'll have.
Okay, beautiful. Give us an example of one of those drills that you might give them.
Yeah, so allowing for the fact that you've had appropriate, if you have an athlete, let's say, that's on single leg hopping drills or is starting their early single leg landing drills, a marching drill with the stick overhead in terms of trying to maintain that neutral pelvis and trying to get good ground contact and appropriate swing leg recovery into knee flexion. And you can bring that into a little skipping drill as well, trying to reinforce those patterns, getting them either marching or jogging across hurdles without letting their legs flare out to either side. You can also bring perturbation into it. We'd get them with a dowel over their head and small light weights hanging off either side, which is going to perturbate them or pull them around. So they really have to work on their anti-rotation, anterior pelvic tilt stabilization. We do a lot of work with med balls and with water bags. So when they're doing the marching drills, they're getting the perturbation of the water, trying to stimulate normal patterns as well, and trying to reinforce the patterns that I mean, the vast majority of athletes later on down the line, they have poor trunk position. So they tend to be quite sat down or anteriorly tilted, so you can work very early doors in that. They tend to have poor swing leg recovery. They tend to just shuffle almost like they're on the ice skating or skier machine in the gym. And they tend to have poor ground contact. They're too long on the ground, either smacking the heel off the ground in front of them or just generally being too sat down. So trying to encourage these tall patterns of running. With running development, some people are quicker learners than others, like in any other skill. So the more entrenched their pattern is, the more time it takes to reinforce these drills. And it's very often people will say, you know, what's the point? Should they just go back running, or, you know, it's too hard to do? Of course, it's hard to do, but if your goal is to leave this athlete better than you ever found them and is to minimize the amount of abuse and load that goes through the knee during these running patterns, it's an aspect, both performance enhancement and knee joint unloading, that you need to consider and need to start adopting in.